when we take advantage of our affiliation with our families and our friends, those supports can do a lot to help us regenerate and be able to go back into an environment that can be stressful just because of significant chronic stress. Now, in that situation of repeated exposure, not necessarily to direct trauma, but when people around you have had a traumatic event, it can be important to watch for the signs of what's called compassion fatigue. After you've spent enough time trying to take care of others, even though you may not be directly affected by the trauma, there is a kind of a residue that vicarious trauma begins to affect individuals who give support. And through that persistent and chronic exposure, there are changes that happen in the brain, and it basically releases not just the acute stress hormones such as adrenaline and noradrenaline, but also the chronic stress hormones, which is cortisol. Unfortunately, that persistent exposure to the cortisol can wear us down. It can knock our immune system down a few notches. It can make us more irritable, more stressful. It can impede restful sleep. And unfortunately, when you get to a tipping point where those things start to be compromised, some individuals will feel themselves to very much be caught into a difficult position. And as that compassion fatigue evolves into something called burnout, then people suddenly lose their perspective. They can become very disillusioned with the institution or their life or their purpose in what they're doing, be it teaching or providing care, often both. And left unchecked without some time to restore themselves, it can lead to other things like anxiety and depression that can reach clinical levels. So again, to go back to affiliation, good diet, exercise, good nutrition, including vitamins, close monitoring, a little bit of caffeine we know is actually very healthy, but I've seen individuals who go into drinking, a lot of caffeine, 5, 6, 7 cups of coffee or soda pop. And that can lead to dysregulation, difficulty with sleep, and even problems with the heart. So I do encourage people to be very careful about just how far they take their caffeine. And then any other alcohol or substance use is to be very, very closely watched, because it can easily lead to decompensation and worsening of symptoms. So if one catches themselves, or if you're aware of a friend or a colleague who's challenged by these things, we do know reaching out, trying to be supportive, trying to bring in resources, that's actually helpful. When we leave things unspoken and unaddressed, most problems only get worse. And if you do begin to ask someone about this in a very gentle way, or maybe ask their supervisor to just check in with them, hopefully they can respond in a way that's accepting of support. Then, of course, there's always clinical referral, which I think is very important to consider when there's a loss of functioning, or if a person begins to feel themselves to have any kind of destructive impulses. There is online some very good and useful tools. One of them is called Psychological First Aid. It is really designed as a technology that's very straightforward. It kind of gives you a script as to how to speak to someone in a respectful and supportive way. It's actually used by the American Red Cross for the people who are volunteering with the Red Cross to know how to check in with people during trauma or disaster. I might mention, should a person struggle with a clinical level of challenge, be it anxiety or depression, even if it approaches a person having some self-destructive or destructive thoughts, we have excellent treatment paradigms. Some involve psychotherapy, some involve medication. Often we use those together. The overall success rate when we combine those therapies is approaching 80%. And even when the first intervention is not successful, a second intervention, a different medication or a different form of psychotherapy, again, will have an 80% chance of helping the individual. So it's really quite hopeful what we have to help people through these types of challenges. So I do thank you for allowing me to share some time with you. I hope the noises were balanced and you could still hear my voice. And I hope you all have an excellent spring. And I wish you, your colleagues, your families, the very best in what is yet to come. Thank you.